right, so I'm just going to start off today by talking a little bit about my career path before I actually go into what a pharmacist does. So throughout high school, I was actually really privileged to get the opportunity to work in a community pharmacy once a week. So I did shadow a pharmacist, and that's where I kind of decided that, I could be a pharmacist for the rest of my life. So I really like the idea that as a pharmacist, you got to work closely with your clients, a lot more than other healthcare professionals do. We see our clients on a daily basis sometimes. If they're having a lot of problems, they come in and just stop by to say hi. Compared to physicians and nurses who only get to see their patients maybe once a month, once every 3 to 6 months, I get to see them on a weekly basis, and they can pretty much call me whenever I want. So the fact that I was so accessible to the community was the reason why I really wanted to be a pharmacist. And after I guess he went through my introduction about after high school going to university and into pharmacy school, so we'll skip that part. But basically, after I completed my internship, I did move to Thompson, and then I've been there ever since last year, July. So I'm still very early in my career right now. I don't exactly know where I'm going to go next and what steps I'm going to be taking. I'm still trying to get used to being a pharmacist and getting my feet wet. So I know a lot of you are high school students, so I did want to go through the education a little bit with you so you know what you're doing in case you do want to apply to pharmacy. So there's no work experience actually required to be a pharmacist, but you do need the university degree. So in order to be enrolled into the faculty of pharmacy, these are the requirements here. I did kind of list them out according to the University of Manitoba standards. Every university is a little bit different. So at U of M, they actually do look at your high school requirements. So you need a minimum of 60% in your pre-calculus 40S, bio 40, and chem 40S. They will look at those marks. And once you do enter university, you can apply to pharmacy after your first year, but you must complete a full-time course load of 30 credit hours. You have to have a minimum GPA of 3.5. 3.5 is the minimum. To be competitive, you actually want to get as high as you can. The marks are very important for pharmacy. There is a list of prerequisites as well. They usually include biochemistry, calculus, so it's good that you take those ones in high school. No letter grade less than a C on your transcript. Once again, you want to get those marks as high as you can. It is a pretty competitive program, so you need to study really hard. I believe the seats, there's about 55 people they accept a year, and about 200 to 300 people apply a year at the University of Manitoba. So once you've entered the faculty, it is a 4-year program, and then after that you will receive a Bachelor of Sciences in Pharmacy. So now you do have a degree in pharmacy. However, in order to practice pharmacy, you need to write a national board exam, and that's offered by the Pharmacy Examining Board of Canada, and it's only offered twice a year. So you write that one, and then once you've passed that, you've become a licensed pharmacist. So I wanted to go through the daily routines and responsibilities of a pharmacist. However, depending on what area of pharmacy you work in, which I will go over with you guys later, the daily routines and responsibilities are completely different. For example, as a hospital pharmacist, you don't always directly dispense the medications to patients. A lot of the time, they're actually sent up to the ward where the nurses are then giving patients their medications. I'm a community pharmacist, so I am actually directly dealing with the dispensing of medications to patients. So, contrary to popular belief, we don't count pills. I don't remember the last time I actually counted a pill. So we are required to check prescriptions and dispense the medications. And when we're checking prescriptions, we're checking to make sure it's the right patient, the right medication, the right dose of the medication, and the indication of the medication as well. So making sure that it's for the right condition, for the right disease. Pharmacists are drug experts, so that is where we are specialized in. So that's what we're checking to see. And in cases of certain health conditions and diseases, certain medications can't be used. For example, if somebody has kidney failure, there are certain medications you can't use at all. Otherwise, we need to actually reduce the doses of the medication. So that is where we come into play in healthcare. I'm also, most of my day, probably 50% of my day is spent communicating with other healthcare professionals. So whether it be physicians, whether it be nurses, people's mental health care workers and their social workers, we are consistently communicating with them, whether it be by phone, by fax. Physicians are consistently calling us and asking us about medications. We're calling them to verify the prescriptions that they write. Another big part of pharmacy is counseling and educating. Counseling and educating kind of go hand in hand. We are responsible for talking about the medication with the patient. So going over the possible side effects of the medications and whether or not there's going to be any issues with the other medications that the patient's on. So our goal is to minimize the side effects of the medications, but at the same time, we need to maximize the benefits of the medications. And listening to a patient's concerns, that's really important when it comes to counseling, because a lot of people come in, they've only heard the bad things about the medications. They haven't heard the good things and the benefits that it can bring to them. So it's important that we talk about those things with the patients, and when they leave the pharmacy, that those concerns are gone. So that goes right into educating, where we're talking to patients about their medications. We do educate other healthcare professionals as well. We're telling everybody about the medications, the disease states. Doctors are calling us and asking us, what dose should we use? How should we use this medication? What should we expect? But we also talk about non-prescription remedies and lifestyle choices. So I always go back to diabetes because it's a very simple or easier way of explaining. But if somebody has diabetes, we're trying to reduce their blood sugars and get their blood sugar under control. Not only do we talk about their medications, but what else do they do? What do they eat? Do they exercise? And those all will help to bring down their blood sugars as well, but it will benefit the medication too, so we can maximize the benefits of the medication. So another reason why I was excited to come speak here this week is because it is Pharmacist Awareness Month. If you guys have been listening to the news or reading the free press, pharmacists can now perform additional services. So in addition to what we already do, we are expanding our roles. So some of the roles that are going to be expanded, and all of these do require additional training that we're taking. We can administer drugs by injection, so that would be giving vaccines. We can prescribe medications, but we are limited to what we can prescribe. So for non-prescription medications, such as cough and cold products, or over-the-counter medications, we can prescribe for those. For medical devices, so an aero chamber if somebody has like an inhaler, or diabetes testing strips for somebody who has diabetes. If they do have insurance coverage for their prescriptions, we can prescribe those. And for self-limiting conditions, so such as acne, there is skin reactions, certain ones, and as well for the smoking cessation products. So like the nicotine patch and the nicotine gum, we can prescribe those and help people with those as well. We can also provide continued care prescriptions, meaning that if somebody's been on a certain medication for months and months or years and they run out of refills and they can't see their doctor in time, we can get them additional medications. And adapting prescriptions is basically we're working with other healthcare professionals, such as doctors and nurses, to change the doses of medications. So in advancements and opportunities of pharmacy, there are a lot of different opportunities in pharmacy, and I actually didn't learn about quite a bit of these until I got into the program. A lot of it is dependent on the pharmacists themselves. They're not required to do additional training, but it's up to them. So in retail pharmacy, so where I work, you can actually become an owner of a pharmacy, or you can become the manager, which happens in certain chains. So if somebody does like to see the financial side, that is something that is there for them. Pharmacists do work in the industry, so that would be doing the research, the testing, and the productions of pharmaceuticals. So, and a lot of the time they're involved in the development of that drug information leaflet that comes in medication bottles as well. We can also we can go back to school and further education and get a master's in sciences or a PhD in pharmacy, which is more research related. And a lot of the time those pharmacists are working at schools and teaching. We can further our knowledge as well and get a PharmD, which is not research related, but more so clinical. So you do rotations in specialized areas of practice. Pharmacists also work with the government and the armed services. So you will see them working alongside with RCMP and Forensic Sciences Lab, where they're doing drug testing and testing urine and blood cultures. And specialized scopes of practice as well. So you can become a certified diabetes educator, where you have taken additional training and written board exams to become fully aware of diabetes, not just the medications, but when you're looking at the nutrition, the lifestyle, and everything else that's considered. You'll see pharmacists working in oncology, so such as Cancer Care Manitoba, where they specialize in the medications for cancer. Same thing in infectious diseases, where the pharmacist will be specialized with antibiotics and so forth. So the qualities and skills of a pharmacist. So communication, I talked about how 50% of my day is probably spent communicating, probably more than 50%. So communication is key. Whether it be on the phone, whether it be on a piece of paper or faxing over to a physician, communication is a required skill. When you're in the hospital, if you're a hospital pharmacist, you're consistently charting on the patient's notes what you talked about with them or what happened. You don't have time to write 2 or 3 pages of what happened. It's going to be 3 or 4, maybe 5 sentences, because the next healthcare provider that comes in is going to read your notes and they have to know everything that went on. So it's very important that you have good communication skills. The ability to problem solve. We're going to have patients come to us who have multiple disease states and they're on multiple medications with, they may be having a side effect. So our job is to sit down with the patient and talk about what's going on and be able to kind of make weight and see where are they having problems with their medications. Precise and detail-oriented. Because we fill prescriptions that can potentially harm patients, it's important that we're consistently looking for problems, whether they be drug-related or disease-related or to that patient-specific condition. We have to make sure that the medications don't do any harm to the patient. And empathetic. A lot of the time we see patients that have been diagnosed with a certain condition, and sometimes people are very upset. Being empathetic allows us to understand another person's point of view. Even though we've never been in that similar situation, recognizing somebody else's concerns does allow that patient to be more comfortable and open with us. So ability to work with others. A pharmacist never works on their own. You're always part of a team, so you need to be able to work with others. Willingness to accept responsibility and leadership. With our expanding roles, we will have more responsibility, so we need to be able to accept that. And we do have leaders. We need leaders because now with our expanding roles, we need to promote our services and have people that actually want to do those services. So the working conditions, I did try to look into a salary of a pharmacist, and I want to kind of to have it averaged across the board through Canada. The government websites aren't that good for showing us numbers, but from what I figured out, and this seems reasonable, you're going to make a pharmacist makes about $45 an hour. So if you're working 40 hours a week, you're looking at about $80,000 to $90,000 a year, roughly. Saying that, location is a big incentive for what you're getting paid as well. If you're working in a rural area, in a more remote area, you will definitely have an incentive of having a higher salary. The hours of work can literally be any time of day. There's pharmacies that are only open Monday to Friday. There's pharmacies that are open 24 hours a day. So depending on where you choose to work, your hours would vary. But you're not always required to work full-time. Some people only work a few shifts a week. So the dress code is usually business casual unless you're working in certain places such as Cancer Care Manitoba. They are usually business attire. And travel. Pharmacists, we don't really travel for our work. Most people do have a home store or a home pharmacy that they work at in the community. If you're in a hospital, you're going to the same place every day. Where I work, actually up in Thompson, we do have pharmacists come travel to help us out when we do need people to fill in if we're going on holidays. So if you are a relief pharmacist, meaning that you are just working as a fill-in, you may travel a little bit more, whether it be just across the city, but it may be across the province. So I just wanted to finish off with some rewards of being a pharmacist and why I'm glad that I chose this career. The big one thing is being part of a multidisciplinary team. So you're working with physicians, you're working with nurses, and you're working with other healthcare providers to help to improve a patient's care, but also to maintain their health. Building trusting relationships with patients. Okay, I lost my sheet, but that's okay. So building trusting relationships with patients. We see people so often because we are so accessible. A lot of the time people come in and if they're doing okay with their medications, everything seems fine. They just come in and see how my day's going and they actually tell me about their weekend and tell me about their children. So it's nice to know that people do have that trust in you. And that goes hand in hand with highly respected member of the community. I believe there was a survey done 2 or 3 years ago now by Ipsos Reid, and pharmacists have been the top 5 trusted professions in Canada ongoing for the past couple of years. And I think a lot of that has to do with how much access we have to the public. Continuously learning, and this is something that I value. This is a career where you're lifelong learning. You're required to keep up with new medications, new disease states, and new guidelines. So that's something that I'm very appreciative of. Being able to own or manage your own pharmacy, you do see the other rewarding side. One side is helping people, but you will see the financial side of this if you do manage or own your own pharmacy. And there is a wide variety of career opportunities. So that is in itself, I think, is rewarding as well, because if you're not happy where you are as a pharmacist, there's always another position available for you.